This is a case that was sent to us, and I actually brought the MRI in because I found it quite unusual. And I brought it here, the last group, to come up with a plan, since this dog had gone to the neurology department at University of California, Davis, had an MRI there, and it's a dramatic MRI. They were stunned. They offered the owner not a whole lot of options. The prognosis grim. And then somehow the conversation came up with my name, and they're in California. They sent the imaging. I brought it here, and there was a lot of discussion, but I didn't know what I could offer the owners other than let's take a look and talk about options. The dog was not stable to fly. So they drove cross country with this dog, at the time about 150-pound dog, for us to assess, and fortunately they went through with the plan. So this is our little miracle story, showing up within the same week of this other dog that had a rare brain cyst associated with Chiari. So just like your patients, we have pediatric patients, and that's a typical pediatric patient, maybe 8 weeks, maybe 2 months old. And they have the same types of lives your patients would have. They go through holidays, they go through birthdays, and they grow up happy dogs, and then somewhere along the line they start developing some problems. This dog, around 6 months of age, started developing some neurologic signs, head tilt, weakness, and was seen, like I said, at the vet school. So they have a very renowned program there. They localized the cranial cervical junction area. They had done an MRI, and their MRI was a low field MRI. I didn't bring it, but this is the MRI that I brought to the meeting. So we have a lot going on. It was quite a busy MRI with hydrocephalus. We have intracranial subarachnoid cysts, profound Syringomyelia, and what you might call secondary Chiari malformation from all the action going on in the caudal fossa. And you can see this area here represents functional tissue. This maybe 1 millimeter sliver here and here, with most of the cord being compressed at that junction. I mean, I would say maybe less than 5% of the cord left to function, the rest subject to severe compression. Just quickly, I segmented out some of the MRIs. Up there is the cervical region. You can see the Syringomyelia is quite profound, traveling all the way down to the thoracic region, pocketing periodically down to the lumbar region. It's hard to discuss reversible changes in a patient like this, even though it was fairly acute when you think about it. The dog's 6 months of age. So within a matter of months, this seemingly developed. Great owners, enthusiastic, and a lot of feedback from you all on what to do. So we run a 3-Tesla MRI. We're able to get Mobi views. So this is a nice way to sew the images together to get a perspective of what you're dealing with. We set out on our plan, which was a foramen magnum decompression. And I don't know how good the image looks with the lighting, but we're looking at the cerebellum and the cranial cervical junction there. We're doing a durotomy. We do durotomy. We do a durectomy on all our patients. We don't have any issue with CSF flow. So all our patients get a dura removed in the dorsal surface of C1 for an effective decompression. We find if you don't remove the dura, which is what's done by some colleagues overseas, and the colleagues overseas report surgical success lasts about 2 years. So their recommendation with surgery is it's a temporary fix. It lasts 2 years. Patients get put to sleep. Catherine and I both have traveled there, looked at the technique. They do a much smaller decompression. They actually do a durotomy and suture collagen in. They experience high rates of scar tissue formation, and they don't do a cranioplasty. So it's a vastly different technique with vastly different results, and that's why we're happy to present our results. So here we are doing the durectomy. And you can see the cyst right there. I don't know if you actually can see the cyst, but this discolored tissue here is the cyst, having retracted the cerebellum dorsally. That's the cyst being removed, drained and removed, and that's our decompression site with the brainstem looking quite flattened. It's fairly dramatic. Placing our screws for a cranioplasty, titanium mesh is formed around the surgical site. The methyl methacrylate applied and a fat graft placed near the tip of the cranioplasty to prevent any scar tissue from trying to creep in. Then we performed a ventriculoperitoneal shunt. So we come across the temporal region there and place our shunt and tunnel it. And our patients, probably similar to yours in pediatric, this dog's going to go from, by 1 year of age, will be 200 pounds. And by 2 months was 80 pounds, 90 pounds. So the growth rate on a Great Dane is quite profound. And this is really not a pure Chiari, but one of the first dogs we ever had over 30 pounds. It is the first dog we ever operated over 30 pounds that we're calling Chiari malformation, but that's a loose discussion of what this is since there was so much going on. So there you can see a radiograph post-op of our shunt placed in the ventricular system. You can see the pump. These are self-pumping, low-pressure pumps we use, similar to what we get them from you all, so you all know what they are. And we tunnel it under the skin, ending up in the abdomen. That's post-op CT scan. You can see the shunt and the button on the temporal region. Here. See the shunt placed intracranially. Just to make sure our placement is reasonable, we can evaluate flow intra-op to make sure it's functional. And this is the joyous 6-month return. So every patient that we operate gets a free MRI 6 months. You say free and they're driving from California, you get a free MRI. And this is Arya 6 months out. And this dog was barely ambulatory before, tipping over and came in a wagon. So 6 months out. I'm not sure you take your patients in the parking lot to walk around. That's part of your assessment, but we should cover up the license plates of the vehicles. So this is pre-MRI 6 months out. The owners report this tremendous improvement. Not normal, but much improved. And here's our MRI, post-operative MRI 6 months out. I did a little comparison shot so you can see the pre-op ventriculomegaly, cyst present. You can see the post-decompression. There is some residual compression in the cranial cervical region on the post-operative. You can see the ventriculomegaly has resolved with the shunt. And then Arya heads back to California to live life. And we'll come back annually for MRIs. They're so happy. So that's our unusual story. I'm going to give a little plug to my dad. My dad is a pediatrician. So my dad's a retired pediatrician, and he helps do the research and edit our research projects at the hospital. So he works 40 hours a week doing that. And somewhere a few years ago, he said, I can help you out more if I knew more about veterinary medicine. I don't know the terminology. So at 80 years old, he enrolled in college and became a veterinary nurse. He passed his licensing exam a few weeks ago and will be graduating, having gone to night school for 4 years to get a degree in veterinary nursing. And newspaper covered the story since they follow him around for a couple of days to see what life's like as an 84-year-old who works in the day and goes to school at night. So my dad is a veterinary nurse, and we get to operate cases together. That's a little plug for my daughter, who is a budding artist and designed the Chiari book. I put an example out there. She did a book for our hospital depicting all the doctors in our hospital. So when the patients come in, the children can actually see the doctors that are treating their dog in the form of a coloring book. We took the idea one step further, working with CSF, and came out with a dog Chiari book, since we see enough Chiari patients and the kids have a lot of questions. A fair number of our patients, I wouldn't say fair number, but it's not unusual to say someone, I know someone who has Chiari in my family, or they'll turn around and show me their scar. Their dog has Chiari, they have Chiari too. So this helped put them at ease, and she designed that book. That book is available. If any of you find it of interest, it's you can contact through CSF, and we'll ship you at no charge examples to put it in the hands of your patients if you think it helps put them at ease. And I guess some studies have shown that adult coloring books are on the rise to lessen your stress. So if you've had enough of taking measurements in the back and you want to color a picture or two, I'm in there. I'm the neurosurgeon with the hands up that looks very scary. I got that, and that's my daughter doing a self-portrait. And that's all I have for you. Thank you.
Did you give any consideration to just doing a shunt instead of doing the decompression? You guys had a discussion last year. I wasn't here. Is that thought about it?
We thought about it. In veterinary medicine, we have this expression: if you're under the hood, you got to change the filter, check the oil, and it can rotate the tires too. So there is some thought process that you might be back. And we felt it best, to drain the cyst. But there was a lot of consideration to just dropping it and draining the cyst. But
Dom, I
we felt it best to take care of all of them at once, given this was a one-time shot at doing it. And our complication rate with the cranioplasty is quite low. So
what's your duroplasty again? Remind me, you said it.
We resect the dura, and they use a collagen graft overseas in an effort to get a watertight seal. So that goes along with, I guess, human medicine, watertight seals, and what other leakage issues you all have. We don't experience leakage issues at all. We almost never reconstruct the dura. We never reconstruct the dura.
Well, and when you go back the second time, it's not scarred down? Not that you have many
No.
second time through, but.
We first did the technique before cranioplasty, and that was, we went to the Chiari Institute to help solve the issue of 25% scar tissue going back and resecting scar tissue. It was obviously quite dramatic. So once we did the cranioplasty, it dropped quite low. Didn't eliminate it, but dropped it to single digits. We added the fat graft in, and that has almost eliminated revisions. We haven't done a revision in years.
No?
You know, once in a while, someone will dislodge a plate, but in 400 or 500 cases, you might have seen that once or twice.
Fraser, you want to?
On that last picture of the dog, there's some retroflexion of the odontoid. Do you find that you don't need to take care of that if you do the stabilization? Or do you sometimes address that through a C1-2 manipulation fusion?
We do. We frequently address it. This was an unusual case. So when we work with the Yorkie, the Silkie, the non-cavalier patient that was coming in for quote Chiari malformation, through the knowledge we gained here, we found really it's cranial cervical junction abnormality, and a lot of them have the instability. So we have a case series of dogs that we stabilized ventrally, rolled over, did the cranioplasty. They do quite well. My experience is if you fail to address that, it will be a problem. It's a progressive problem. And it was when we met with you, frankly, I forgot how many years ago in Philadelphia, that you opened our eyes to go back and look at your MRIs and figure out, and it was the patients that progressively didn't do well had the instability, went unrecognized. So now we're on it. Every patient gets an MRI, CT scan, X-rays, thermal imaging, hearing test. That's our standard workup.
All right. Last question, Jerry, because you're holding everybody from.
You know how hungry I am for mammals.
You were
I'm just a real quick about the dura. You know, we did a human study a few years ago at Duke looking at genetics of the dura. I thought that would be the holy grail. It was tricky, but some of the genes we picked up, I'm just curious if you're freezing the dura to look for some of the genetic mutations, because it would be similar probably to look at.
We're not doing any genetics.
No genetics.
Yeah. There are other people doing genetic studies on just trying to figure out how to breed it out of the cavaliers, but you know, we send them in formalin and get them randomized.
Yeah. Last question, Roger.
Wasn't there an earlier technique in humans where they didn't close the dura? I
Well,
know
there's
a
still
number of surgeons that
there's
don't.
still a surgeon in LA that doesn't close the dura, and he does a fascial closure. Sure. I mean, you know, we were talking back there, anything from a linear opening to a Y-shaped opening to no dural closure to pericranium to other material. I mean, there's a wide variety, and certainly not enough patients to do true randomized clinical trials, nor the willingness of patients to subject themselves to that. So it's and you saw, I thought David Lindbergh did a beautiful job saying, look, we can't control for what the surgeon does intradurally and how they sew in their patch and so on. And I think that is a confounding element to all of this.